So I've been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but I think we've made a lot of strides. Wish it was done a long time ago. Today, we're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Thanks as well to the director of the National Institute of Health, Dr. Jay Bhattacharya, FDA Commissioner Dr. Marty McCary. These are great people. Administrator of the Centers for Medicine and Medicaid Services, Dr. Mehmet Oz, and Acting Assistant Secretary of HHS, Dr. Dorothy Fink. So thank you all. Thank you, Dorothy, very much. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, you know, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them this is what we have to find out. Because when you go from 20,000 to 10,000 and then you go to 12, you know there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child a Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you can't tough it out, if there's a problem, you're going to end up doing it. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period. Take it over 5 times or 4 times, but you take it in smaller doses and you spread it out over a period of years. And they pump so much stuff into those beautiful little babies. It's a disgrace. I don't see it. I think it's very bad. They're pumping, it looks like they're pumping into a horse. You have a little child, little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times. I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And it's artificially induced. It's not like something that when you go from all of those, healthy babies to a point where I don't even know structurally if a country can afford it. And that's the least of the problems. To have families destroyed over this is just so terrible. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate, because when that got mixed in, I guess they made it 4 for a while, it really was bad. So they make chicken pox. Individually, they're
all right, we're going to continue to listen in to the president's announcement here, but we do want to fact check a little bit of some of the claims that he is making here about vaccines and medications that are taken during pregnancy. With me now, health and medical reporter Erica Edwards. Erica, what most stands out to you here in some of the things the president has said in the initial part of his remarks?
I don't know where to start. So many things. One are his numbers that he's coming up with. We've already known that in the year 2000, 25 years ago, it was just 1 in 150 children. The American Academy of, obstetricians and gynecologists all say that Tylenol is the safest drug to take during pregnancy. We already know that 65% of women, when they're pregnant, take this drug at some point or another. We know that fevers during pregnancy can actually be harmful to both mom and baby. It can lead to dehydration and other issues. So that's why doctors recommend bringing those fevers down. He's now going on about vaccines, separating MMR. There is no indication whatsoever that separating those shots, it's just not even possible, right? Like the MMR vaccine has been in existence for decades. It's very safe. It's very effective. What I think that he's probably referring to is last week, CDC's Vaccine Advisory Committee was looking into a combination MMR and varicella chickenpox vaccine. They decided that babies as young as 1 year old should not have that combination shot because it can, in very rare circumstances, lead to a febrile seizure, which is obviously very scary for parents to watch. It lasts, a couple of minutes maybe, but it does no long-term damage. The point is that vaccine committee has already sort of known that that can happen in age 1, but has nothing to do with what we're talking about right now, which is autism.
Okay. All right, Erica, continue to listen in. We're going to go back to what the president is saying, but if he says something you think we need to check, just let us know. Back to the president.
And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot. And I want to say it right now. And, the way I look at it, don't take it. Don't take it. There's no downside in not taking it. So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on the subject for a long time. Life is common sense, too. And there's a lot of common sense in this, and I wish things like this were brought up. And this group has worked so hard on it, but I'd like to be a little bit more, a little speedier in the process of a recommendation, because there's no harm in going quicker. There's absolutely no harm. At worst, there's no harm. Thank you very much. Bobby, please.
Thank you, Mr. President. To meet the president's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. At President Trump's urging, NIH, FDA, CDC, and CMS are turning over every stone to identify the etiology of the autism epidemic and how patients and parents can prevent and reverse this alarming trend. We have broken down the traditional silos that have long separated these agencies, and we have fast-tracked research and guidance. Historically, NIH has focused almost solely on politically safe and entirely fruitless research about the genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question, despite the cataclysmic impact of the epidemic on our nation's children. We are now replacing the institutional culture of politicized science and corruption with evidence-based medicine. NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Today, we are announcing two important findings from our autism work that are vital for parents to know as they make these decisions. First, HHS will act on acetaminophen. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. Scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development. We have also evaluated the contrary studies that show no association. Today, the FDA will issue a physician's notice about the risk of acetaminophen during pregnancy and begin the process to initiate a safety label change. HHS will launch a nationwide public service campaign to inform families and protect public health. FDA also recognized that acetaminophen is often the only tool for fevers and pain in pregnancy, as other alternatives have well-documented adverse effects. HHS wants, therefore, to encourage clinicians to exercise their best judgment in the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required. Furthermore, thanks to the politicization of science, the safety of acetaminophen against the risk of neurodevelopmental disorders in young children has never been validated. Prudent medicine, therefore, suggests caution in acetaminophen use by young children, especially since strong evidence also has associated it with liver toxicity. Some studies have also found the use of acetaminophen in children can potentially prolong viral illnesses. FDA will drive new research to safeguard mothers, children, and families. In addition to a possible acetaminophen connection to autism for pregnant women, infants, and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism. We have also identified an exciting therapy that may benefit large numbers of children who suffer from autism. Peer-reviewed literature has documented that up to 60% of folate-deficient children with ASD can have improved verbal communications if given leucovorin. I have instructed NIH, FDA, and CMS to help doctors treat children appropriately. Jay will help tell that story, which started with sound science, the kind that restores faith in government. This announcement also represents a historic collaboration between NIH, FDA, CDC, and CMS. We expect this to be the first of many announcements over the coming years that deliver actionable information to parents on underlying cause of autism and the potential paths for prevention and reversal. Finally, autism is a complex disorder with multifactorial etiology. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines. Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine. President Trump believes that we should be listening to these mothers instead of gaslighting and marginalizing them like prior administrations. Some of our friends like to say that we should believe all women. Some of these same people have been silencing and demonizing these mothers for 3 decades because research on the potential link between autism and vaccines has been actively suppressed in the past. It will take time for an honest look at this topic by scientists. But I want to reassure the people in the autism community that we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we find. We are researching this issue to all 3 agencies. Jay will discuss one of our research initiatives at NIH. This model of unleashing unbiased, depoliticized, gold standard scientific research and academic freedom to deliver actionable information to prevent and reverse disease will be a model for the framework to deliver similar results for many other chronic conditions that plague Americans. Jay?
Thank you, Secretary Kennedy, and thank you, President Trump.
Thank you very much.
I'm proud to announce today that the NIH has launched the Autism Data Science Initiative to turbocharge autism research, devoting an additional $50 million to the cause of studying autism. Nearly 250 research teams from across the country applied sent in their applications and were peer-reviewed by the NIH review panels. The NIH peer reviewers chose the 13 best projects focused on root causes and therapies, with replication and validation studies to guarantee gold standard science. The studies feature a new kind of science called exposomics, where scientists consider environmental and medical factors, nutrition, events during pregnancy, in combination with biology and genetics to answer vital questions about autism. Science like this, conducted in partnership with families and physicians, is the best way to arrest and reverse the autism epidemic. Autism spectrum disorder encompasses a very wide range of symptoms, ranging from mild difficulties with social interactions to profoundly autistic children who experience severe disabilities in speech and behavior. Given this wide range of symptoms across the spectrum, it seems certain that there will be a wide range of biological contributors to explaining the cause. The great thing about the new NIH initiative on autism is that scientists will use rigorous advanced methods in causal inference, machine learning, organoids, and other fresh approaches to the problem. The sharp rise in the prevalence of autism deserves an urgent response by the scientific community. As Bobby said, the NIH has invested a lot of money to study autism over the years, but the research has not produced the answers that families and parents of autistic children deserve, and autistic children themselves deserve. For too long, it's been taboo to ask some questions for fear the scientific work might reveal a politically incorrect answer. Because of this restricted focus in scientific investigations, the answers for families have been similarly restricted, often pointing families to behavioral therapies that don't work for every kid or suggest non-modifiable genetic factors as the cause. But genetics alone can't explain such a sharp rise in autism prevalence over just a few decades, as the president said. In coming months and years, as NIH scientists learn more that can help autistic children and their families, we won't delay. Like scientists often like to do, I can say as a scientist myself, it's really tempting to delay, but but in face of a problem like this, you have to move fast. But we will not delay before telling American people about what we find, and we will win the public trust with transparency and rigor. Already, our broadened focus on autism research has pointed to 2 items that will help families prevent and treat some cases of autism. I'll leave the good news on these 2 items to my close friends and colleagues, Dr. McCary and Dr. Oz. We've been working together closely on this problem for the past 6 months, and our cooperation represents an unprecedented collaboration with Secretary Kennedy's Department of Health and Human Services and with President Trump. I'm delighted to introduce Dr. Marty McCary, Commissioner of the Food and Drug Administration, who will tell you about these announcements of practical help for families with autism.
Great, thank you, Dr. Bhattacharya. Mr. President, this is the start of a historic shift in medical culture. This administration is working together to ask big questions about why our nation's children are getting sick so fast. Too often, medicine is doing small little studies, giving us answers we already knew. But we've got to make a difference. You've given us a charge to identify root causes, and we are not going to stop so that we can end the suffering we are watching. And if you've seen a kid with autism, with severe autism, it's hard to watch. Kids get frustrated, they get angry, they can be crying because they want to speak and they can't speak. It's hard to watch, and it may be entirely preventable. For an epidemiologist, that child is an expanding statistic. But for a child, it can be brutal to have autism. Today, the FDA is taking action to update the label on acetaminophen and sending a letter to all U.S. doctors letting them know about the risks in pregnancy. We now have data we cannot ignore. There's a very large study, the Boston Birth Cohort, with researchers that have, from Johns Hopkins, my former institution, and Boston University, found, quote unquote, consistent associations between acetaminophen in pregnancy and autism. And the Nurses' Health Study with researchers from Yale, Columbia, and Harvard looking at 9,000 kids found that acetaminophen use in pregnancy was associated with neurodevelopmental disorders. And 4 weeks ago, a Mount Sinai Harvard study reviewed all the existing literature and found the overwhelming body of evidence points to an association. Sure, you'll be able to find a study to the contrary. That's how science works. But to quote the dean of the Harvard School of Public Health, there is a causal relationship between prenatal acetaminophen use and neurodevelopmental disorders of ADHD and autism spectrum disorder. We cannot wait any longer. And honestly, there's been this perfunctory, reactionary mindless practice in medicine. I learned it in medical school and residency. Just treat all fevers, low-grade fevers, treat them with acetaminophen. Why? What are we doing? A study out of Hopkins actually showed that treating a fever can prolong the duration of illness in a young kid. Maybe that's because
you have been listening to this event, of course, at the White House with President Trump. That big announcement on this new warning on a key ingredient found in pain relievers like Tylenol, linking it to autism. Although there are questions about the science behind some of these recent studies, causation versus correlation, et cetera. Scientists have been looking at this potential link between autism and acetaminophen for years, but the data, according to experts, has been fairly inconclusive at best. And major medical groups say acetaminophen is one of the only safe pain relievers for women during pregnancy. We're going to come back into this event once the president, if he does, starts to take questions or speaks again. So we'll leave it up there. But I want to bring in, as we've got team coverage here, our medical correspondent, Erica Edwards. Dr. Kavita Patel is also with us, as is Vaughn Hilliard. Erica Edwards, let me start with you here, because you heard the president in extraordinarily clear terms say, don't use Tylenol, as he said, Tylenol. Again, being clear, we're talking about acetaminophen here. Give us a context check on some of this, because there are some questions regarding what the president and his health secretary are putting forward.
Yeah, you know, this was an extraordinary announcement, mainly because of the misinformation that I heard from our president. Starting with the numbers of autism cases in the U.S., he was claiming that it was 1 in, I don't know, whatever thousand, just 20 years ago. Let's put it this way. In 2000, there was 1 in 150 kids with autism in this country. In 2016, it was 1 in 54. Now it's 1 in 31. And experts who have been studying autism for decades say that there's nothing new going on biologically, but it's because we have increased awareness and that we have expanded the definition of autism spectrum disorder overall. As many as 65% of pregnant women take Tylenol sometime in their pregnancy. And so, you know, the doctors I've talked with said that there is absolutely no evidence that linking acetaminophen with autism. In fact, there was a huge study last year published looking at kids with autism and their siblings, right? They have similar genetics, they have similar, you know, environmental exposures. There was no link with that major study. Hallie.
There's another question, too, related to, you know, why pregnant women would be taking acetaminophen in the first place if they have, for example, a fever. We know that some of these expert groups, these medical organizations have said that can actually be very dangerous for pregnant women, too.
Because fevers indicate infection, right? So if you have a fever, you take Tylenol to get rid of that, or to sort of bring down your body temperature. Fevers in utero have been linked to dehydration in the developing babies, and that could itself cause problems.
I want to come to Dr. Kavita Patel here, who's been listening along with us. One of the things that Erica referenced, too, the idea that we have a better understanding of autism spectrum disorder, that there is more awareness of it, is why this comparison that the president made to Cuba is one that experts question as well. This idea that Cuba has lower rates of autism because they don't use as much acetaminophen.
Right. We know also that the rates of autism have not necessarily been this massive shift just because of all this causality, which, by the way, even these studies between Tylenol were not done in a way where you could demonstrate that causal link.
Pause there. Can you explain that difference? Because that's super, super important.
All right, so let's take the Harvard study that you just heard about. That was actually what we call a systematic review that it's a review of other studies. They included 46 studies, 100,000 people, lots of people, but it was a lot of different studies that were done for different purposes, and then they just retrospectively kind of looked and tried to see if there was any association. So I'll give you the analogy. They may have found that people who took Tylenol had children that had some sort of autism spectrum disorder, but they never necessarily also teased out if they had access to prenatal care, if they also had other things that could have contributed to that diagnosis of ASD. So I think to distill it all to some one thing cause the other is actually not reading the study the way that Harvard intended for it to be done.
We've also heard now the administration and these top health officials, as we're listening, obviously keeping an ear on this, wanting to make sure that we're getting the context checks in too, talk about offering folate and the prevalence of folate here to people who do have autism.
Right, and there's been so much that's been talked about, and we're still kind of hearing it unfold, but there has been a leak, and already now we're seeing the demonstration of this kind of link with a potential treatment For autism spectrum disorder, you heard FDA, NIH, CMS, and now the secretary saying that, well, we have this potential that could be a treatment for autism spectrum disorder. Let me be clear. Those studies have been small. They're promising. And I think what it does is it misaligns that we know that autism spectrum disorder is not one thing and there's not one manifestation. So is there a potential for leucovorin, which is basically a more active form of folate, which is a basic element that we should have in our leafy greens and vegetables? There has been studies that have shown that potentially the uptake of folic acid into the brain is one of many reasons that we can see a representation of autism in children. So I think that it's a very important set of studies to do, but one could argue, and I would, that we have so many other things that we could link and also explore. And so I'm very interested in what the NIH is standing up to understand, are there other studies being done?
Right.
And then I would love to kind of make sure that what I'm worried about right now is that if I'm a mother with a child with autism, I want to call and get on this medication. It's an oral pill given sometimes in 2 doses a day. Why can't I get it? Well, because we just don't know if that will actually help. And we don't want to give anything that could potentially harm or mislead people from a potential treatment that we don't even have for autism spectrum disorder today.
What if, Erica Edwards, let me go back to you and then we'll get to Von Hilliard. But Erica, if you are a woman who is pregnant right now and you're watching this and you're going, well, wait a second, what am I supposed to do if I catch a cold, if I get a fever, et cetera? The advice is always, of course, talk to your doctor, talk to your personal doctor who knows you and who knows your personal health. But I wonder what you've heard from experts as you've been reporting this out over the last couple of weeks.
Yeah, here's the deal. I mean, whether this checks out over time, the damage has been done. Women who are pregnant or are considering getting pregnant are now fearful of Tylenol. They're fearful of acetaminophen. And so that's what folks who I'm hearing from are most concerned about. And so, yes, of course, as you said, talk to your doctor. But yeah, I mean, the fear is already there. President Trump mentioned vaccines. That's also been debunked time and time again. But the fact that, the president of the United States has come out on this national platform to talk about these things is really major, right? And it's something that scientists, doctors have already sort of looked into. And my big question is, why now? Why today is this coming out? Because the doctors I've talked with said there's really no new research that we haven't heard about before that's leading to this particular announcement today, other than the fact that the secretary announced that, earlier this year that he would have some sort of answer by September.
I want to explain to you what we're hearing from Kenvue, which is the maker of Tylenol. Again, we're talking more generally about acetaminophen, at least the health secretary is, although you heard the president very directly point to Tylenol here. And Kenvue says that we believe independent sound science clearly shows that taking acetaminophen does not cause autism. They go on to say, we strongly disagree with any suggestion otherwise and are deeply concerned with the health risk this poses for expecting mothers. They say, Dr. Patel, it's the safest pain reliever option for pregnant women as needed. And without it, and this is what I think is what Erica was speaking to, too, without it, women face dangerous choices, suffer through conditions like fever that are potentially harmful to both mom and baby, or do something else, use an alternative that could potentially be riskier.
Right, or pain. I mean, a lot of what we do is I've got patients who are pregnant with migraines, with headaches, with back pain, all sorts of things. And just weighing the risk and the benefit of acetaminophen for that mother in that situation is exactly what we do. By the way, we don't just say take as much acetaminophen as you want. We actually have, and the standards for the American College of Obstetrics and Gynecology, the American Medical Association, every single major association has said, use it in a sparing way to weigh the benefit and risks, but not because we see this causal link, but just because we tell that to pregnant women about almost everything.
That's right.
I tell women to avoid non-steroidal anti-inflammatory drugs because of some risks potentially to the fetus. I tell women to avoid soft cheese because there might be a bacterial infection. We avoid alcohol and tobacco. That's exactly right. So we put this in line with where we see risk and benefit. And this is Tylenol, acetaminophen, is one of the safest things we can give.
But now, Von Hilliard, you have the levers of government that are behind this move, from Secretary Kennedy, who noted and longtime vaccine skeptic here, from President Trump as well, as they're suggesting now. Secretary Kennedy says that the FDA is going to initiate the process on the safety label change for acetaminophen here. And some of the language here, I think, is absolutely worth noting, because you heard Secretary Kennedy invoke the phrase, believe all women, which had long been used as a phrase since really the Me Too movement for sexual assault victims and survivors. And his suggestion is that you've also got to believe women, mothers, who have children with autism as well. The language around this, obviously political and health announcement, is, I think, worth talking about.
Absolutely. And when you're looking at the two men's relationship, there were a lot of questions that people were speculating whether Secretary Kennedy would be pushed out the door in the past weeks over the firing of the 17 members of the advisory committee on vaccines. And yet we have not heard publicly any reason from the president to question the actions of Secretary Kennedy. And, you know, I was out on the campaign trail with the two men in 2024, and then candidate Trump made very specifically that he was going to let Kennedy, quote, go wild on vaccines and anything else he wanted to go. And so, in large part, this moment here at the White House is affirmation from the President of the United States to the decades-old work that Secretary Kennedy has taken on. And I think that that is where, even in this moment here, you heard the President use, you know, sort of playing almost doctor role there in a way that it's hard not to take you back to 2020 during the COVID response to the recommendations that he was providing that typically would come from medical professionals. But the president himself said, quote, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. And he says taking Tylenol is not good. Don't take it. There's no downside in not taking it. Now, we should be clear. Just minutes later, Secretary Kennedy came out and did, as you guys just outlined, provide the scenarios and reasons why taking Tylenol has long benefited women during pregnancy here. And so I think this is a relationship between the two men. You know, the president suggested that they first met 20 years ago on this. I was at Trump Tower back in 2016 after President Trump won his first race, in which he welcomed Kennedy up to the Oval, or up to Trump Tower. And there were a lot of questions about where these two men's relationship would go, and ultimately President Trump backing the efforts of Secretary Kennedy here in real time.
Vaughn Hilliard, thank you very much for that. We're going to continue to listen in to this event at the White House. Dr. Kavita Patel, Vaughn Hilliard, Erica Edwards. We're going to keep you close as the president is speaking again. Let's actually go in and listen in case he does take a couple of questions here, just for a brief moment.
The term is used throughout this conference. So it's essentially Tylenol. And I just recommend strongly that you don't use Tylenol unless it's absolutely necessary. I understand it's maybe 10% of the women that are pregnant are, would perhaps be forced to use it.
It's worth noting here, again, medical advice from President Trump, who is obviously not a doctor. Robert F. Kennedy Jr. behind him, the health secretary. We're going to continue to listen to this in case the president does take a couple of questions. Let's listen for one more second.
Stronger from me than from the group because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Don't take it. If you just can't, I mean, it's just fight like hell not to take it. There may be a point where you have to, and that you have to work out with yourself. So don't take Tylenol. Other things that we recommend, or certainly I do anyway, is, and it's so important to me to see the doctor 4 times or 5 times for a vaccine. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby. Even if it's 2 years, 3 years, 4 years, you just break it up into, I would say 5, but let's say 4 visits to the doctor instead of 1. And certain things I think you should do. We've already taken out and are in the process of taking out mercury and aluminum now. You know what mercury is. You know what aluminum is. Who the hell wants that?
President Trump here, again, the manifestation of his health secretary's longtime vaccine skepticism. You're hearing some of the president's. He is just delivering advice to pregnant women who will listen. Dr. Kavita Patel, notable to you what the president's suggesting here.
I mean, I think it's kind of stunning because he even acknowledged that his own advisor standing behind him
would not go as far as he would. So to say pregnant women should not take Tylenol, period, full stop, is pretty unusual. And then link that somehow to vaccine schedules, as well as linking that to autism. If you can imagine, not just a pregnant woman, but even somebody who's thinking about what they did during their pregnancy is sitting there right now listening to this and thinking, what do I make out of it? And it's very hard when someone with no medical background is kind of offering
unfortunately, medical advice.
And again, we're talking about acetaminophen, which is in Tylenol, and the makers of Tylenol, just to reiterate here, have provided a slew of other studies that they say back up their assertion that they believe that sound science shows that taking acetaminophen does not cause autism. Let's take it back over to the White House now. President Trump just starting to take questions from reporters in the room. We're going to listen in.
With Bobby 20 years ago, and I was attacked. I said, whoa, what was that all about? I had no idea. You get attacked. I don't know. The medical community, the drug companies, doctors. I don't know what it is. All I want to do, I don't care. I don't care about being attacked. It doesn't matter to me. I believe that the numbers at the end of our term or shortly thereafter could be really phenomenal. I want it to go up, just like it came down to this horrible level. 1 in 10, 1 in 12. I was told 1 in 10. I was told 1 in 12. Today I heard 1 in 31 if you add the girls and the boys together. It's crazy. And it was 1 in 10,000 and 1 in 20,000. It's not even sustainable for a country, you want to know the truth. And there are other places that don't have it. And they have things in common. And that's called medical research. Yeah, please.
Mr. President, I'm curious, as you look at the trend lines,
yeah,
how much of this is the causation of acetaminophen and how much is sort of better diagnosis, doctors, researchers having a better understanding of what is on the autism spectrum?
Do you want to do that? Sure, go ahead.
That's one of the canards that has been promoted by the industry for many years, that it's changed diagnostic criteria, better recognition. But there's been study after study done of that completely debunks that. One of them by the Mind Institute at UC Davis, University of California. But also it's just common sense, because you're only seeing this in people who are under 50 years of age. If it were better recognition or diagnosis, you'd see it in 70-year-old men. I've never seen this happening in people my age. I've never seen a case of full-blown autism, and that means profound autism. I want to be very careful. Head banging, stimming, toe walking, nonverbal, non-toilet trained. I've never in my life seen a 70-year-old man who looks like that. You're only seeing it in the kids. It's an epidemic.
Thank you, Mr. President. I was hoping that you could clear up confusion for moms and dads across America, many of whom voted for you. There's a statement that was put out by the American College of Obstetricians and Gynecologists, and in their statement, they write, acetaminophen remains a safe, trusted option for pain relief during pregnancy, and that's at odds with what you said and with what many of the experts say. How do you clear up this confusion?
That's the establishment. They're funded by lots of different groups. And you know what? Maybe they're right. I don't think they are, because I don't think the facts bear it out at all. They're fighting for something that, in my opinion, they shouldn't be fighting for. But here's the thing. There's no downside to doing, other than a mother will have to, as I say, tough it out a little bit. There's no downside to doing this. It's not like, oh, if you do this, you're going to die. There's no downside. There's no downside to going over a 4-year or a 5-year period or a 3-year period, or even if you space them out for 6 months, you space it out. There's no downside. And that's why I will say the gentlemen behind me, they have very strong views, and they feel that we're right, but they'll have more research done over the next 2 months. I said, well, 2 months is a long time. A lot of people could be saved, and there's no downside to doing it. Everything I said, there's no downside to doing it. It can only be good. And I think you're going to see very good results. That's establishment stuff, and we've been reading that about a lot of things for years. And you know what's happened? We've gone from 1 in 20,000 to 1 in 10,000 to 1 in 32 to 1 in 10. Think of it. 1 in 10 or 12 or 1 in 31. Think of it. 1 in 31 people, young kids, get autism. What is it, Jeff?
My question is about leucovorin. You mentioned that as part of your plan. That is also a chemotherapy treatment. Have you been in touch with the drug companies to increase production about that? And I'm going to throw in my follow-up at the same time. Dr. Oz mentioned that this will be available with CHIP, children who are on CHIP. But the big beautiful bill reduced funding for CHIP and Medicaid by $1 trillion over the next 10 years. Are you concerned that that will impact your ability to get this drug out?
I'll explain it to you in a second, but please go ahead.
Thank you.
Thank you. Leucovorin is not a chemotherapy, but it is a vitamin given with chemotherapy sometimes. And the idea here is that the folic acid receptor in the brain is blocked by some antibody response. It might be 20, 40, 50% of kids with autism. And leucovorin will bypass that blocked receptor. And that's why so many doctors are probably seeing so much clinical improvement on kids with leucovorin.
Production.
Yeah, we've been in touch with the companies, and they are prepared to ramp up production, and we actually talked to them about a month ago.
And on your second part of your nasty question, the number is that the great big beautiful bill, which is the greatest, I think one of the best things ever passed in the history, with the tax cuts and regulation cuts and all of the things it does, no tax on tips, no tax on Social Security, no tax on overtime, all of it does. It also gives $200 million, as just explained by Dr. Oz. And I'd like you to explain that to exactly what you're saying.
The Big Beautiful Bill actually increases Medicaid spending projected over the next 10 years by $200 billion. There's also a $50 billion Rural Health Transformation Fund, which will allow a lot of these programs to get in the rural parts of the country that the President and Congress are handing to governors to start distributing. Those grants have already gone out. The money will be allocated by the end of this calendar year. And I want to point out that the ability of NIH to do research that feeds and hands the ball to the FDA, which then can change labeling to allow Medicaid programs in states to fund this program, will ensure that the things that President Trump and Secretary Kennedy desire are financially affordable for the families around America.
You mentioned CHIP, sir. That's why I asked that question. You mentioned that CHIP would fund this for children.
Well, most of the kids are on Medicaid, probably 43% on Medicaid, another 8-10% on CHIP. And all the programs in general are being evaluated. Most of what the One Big Beautiful Bill was seeking to do was to remove fraud, waste, and abuse. But the programs themselves should stay financially intact for the people for whom they were designed, and in this case, for children.
And the only thing we cut, so that's $200 billion positive. The only thing we cut was for fraud, waste, and abuse, of which there was a lot in this country, and nobody minds that. Yeah, please.
Mr. President, you said that there is no reason to give newborn babies hepatitis B vaccines. But hepatitis B can be contracted not just through sexually transmitted diseases, it can come from needles to open wounds. So when you say you feel, is that appropriate to be telling?
I think it's absolutely appropriate. I think they should wait till they're 12 years old. Yes, please.
Mr. President, thank you all for being here. You've been talking about reducing autism by spacing out vaccines. Would you like other combined vaccines babies receive to be spaced out, like MMRV?
What is this again?
You've been talking.
Speak up, please.
Sir. You've been talking about reducing autism by spacing out vaccines.
Right, correct.
Would you like the other combined vaccines babies receive to be spaced out, like MMRV?
I would say yes, but that just is, for me, it's a lot of common sense involved in this. It's a process, but we're looking, but it should at least be given separately. Now, it's possible that you can reduce them and I'd give them in small doses, but it's possible maybe in that particular case, the MMR wouldn't work in small doses, but you can certainly give them as separate shots. It's been proven to be very safe when you give them in separate shots instead of mixing. So I don't think there's any reason to do that. Do you agree with it? I'm not a doctor, but I'm giving my opinion. I don't think there's any reason to do that. So it's been proven to be safe when you break them up. But MMR by itself, I've heard bad things about it for many years. Yes, please.
Mr. President, is the spectrum too broad, in your opinion? For research purposes, you are dealing with a population of children who might have social boundary difficulties, and then you have children who are, going to grow up to be adults in diapers. I mean, what do you think?
We don't know how broad the spectrum is. We don't know exactly where it starts and where it ends, but we do know what we're going through. We're going through some very serious trouble, and we know autism. I mean, it could be bigger, it could be small, a little bit smaller, but the number is unacceptable. And the number, the way it's come down, because the spectrums remain the same, the number, the way it's come down is just unacceptable, meaning come down to that level of 1 in 10, 1 in 12, 1 in 31.
Mr. President.
in the back.
President, this question is more directed towards Secretary Kennedy. It was talked about that we're just kind of finding out about the fact that babies are affected this way. Is there a concern that information is being suppressed right now within HHS, and could an investigation perhaps be launched, seeing any more
Well, I think
information?
information has been really not given out very freely over the years, absolutely. And I think that's by drug companies and maybe doctors, but I certainly think that over the years. I think this is a different group. We have a lot of information. And that information, I mean, it's the information that we have that we're making these statements. And I'm making them out front, and I'm making them loud, and I'm making them strongly not to take Tylenol, not to take it. Just don't take it unless it's absolutely necessary, and there's not too many cases where that will be the case. And again, what's the worst? The worst is nothing can happen. It's very positive. That's a positive thing. But I don't believe I don't actually believe that's possible. I think the results are going to be amazing. I want to see amazing results by the time I leave this beautiful building. And I will consider this, I believe, you know, with the wars, I've stopped 7 different wars. I've saved millions of lives. I've done a lot of things. This will be as important as any single thing I've done, because I know ladies, beautiful ladies just like this that are going through the same thing. And it's not easy, and I admire you for being able to do it. But I admire him, too. I wish I had a face that looked like that. If I looked like him, I would have been president a long time ago.
Tylenol is widely used in other countries, too. As you make this announcement, do you expect your decision may affect
I
other
hope they
countries?
follow it, yeah. I hope they follow it. Yeah, other countries are, you know, sell Tylenol. Some countries don't. I mean, I hear Cuba, now, again, you'll have to check this out, but I hear Cuba doesn't have it because it's very expensive, and they don't have the money to have it, or they don't want to spend the money to have it. They don't have Tylenol, and I hear they have essentially no autism. So you'll have to check it out. Yeah, Brian.
Medical professionals have warned for decades.
I said, no, not you. You're CNN. You're fake news. Go ahead, Brian.
Thank you, Mr. President. I want to go back to the Amish community, if I can, just for a second. I recently saw a man from Minnesota, an Amish man from Minnesota, on a podcast, and the host asked him what the rates were for like ADHD and autism, and he had no idea about ADHD, didn't know that it existed, and certainly didn't know of any cases. What are they doing?
It doesn't exist with the Amish community, and they don't take all of this junk. It doesn't exist. That tells you, doesn't that tell you? That's like, you know, that's like certain countries where it doesn't exist and they don't take it. Would you like to make a comment about that, Mark?
The Amish population, a very mixed group. So there's a subset that take vaccines, a subset that does not. And we know they have very low rates of chronic disease all across the board.
Please.
Thank you, Mr. President. Should the establishment media show at least some openness to, you know, trying to figure out what the causes of autism are?
I wish they would, yeah.
And why are they so closed-minded?
Well, they just, look, it's not only the media, in all fairness, it's some people. When you talk about vaccines, they go crazy. And, you know, I'm a big supporter of vaccines. I got a certain vaccine approved in 9 months that would have taken from 5 to 12 years. I'm very proud of it. A lot of people think it was one of the greatest things I've done, and some people think, mostly Republicans, actually. I'll tell you, the Democrats think it was, they think Operation Warp Speed was one of the greatest things any president has done, any president. It's, you know, we're very proud of what happened. We got hit with something that came from a place that shouldn't have happened, but it did happen. You know, those things take place, and you're very unpleasantly surprised. But, no, I'm a big believer in vaccines, the polio vaccine, big believer in vaccines. I know Bobby and you guys have it out a little bit, but he's a believer in vaccines, too. But I've seen how great vaccines can be, how incredible they can be. So I'm a believer. Yeah.
Sir.
Yeah, please.
Your comments made about MMR and hepatitis B
You have been listening to President Trump there, surrounded by his top medical advisors, taking questions from reporters in the room. I don't think you heard it before we dipped back into this, but the president suggested, his team said, questions should focus simply on the announcement here. We'll wait to see if there's other topics that come up as well. But a couple of things we got to get into, because one of the things that you've heard is this idea, the factual rate of autism that has grown in this country over the course of the last couple of decades. Experts have said that is largely partly because of more awareness, because of a better understanding of autism spectrum disorder. I want to bring in our Erica Edwards on that, our medical correspondent here, because Erica, you heard Secretary Kennedy call that a canard, basically say that that's a line that's been pushed by, I'm paraphrasing here, but he seemed to imply that has been pushed by kind of the mainstream establishment. You heard President Trump take on the so-called medical establishment as well. Help us understand what the reality is.
Yeah, so you heard Secretary Kennedy saying that he didn't know any 70-year-olds, right, with autism. But that's because decades ago, people with autism were sent to mental health institutions. It's only within the past, 30, 40 years that we've really been able to uncover this disorder and, make sure that we are understanding the spectrum of autism. I might remind folks that Secretary Kennedy, during his confirmation hearing, said that no one should, listen to him when it comes to medical advice. And I would also remind folks that President Trump is not an MD. I don't believe he's ever been pregnant. And so, this is something, these are caveats to keep in mind. The autism community is saying to me that they were really excited when Secretary Kennedy was going to address autism overall, but they are very concerned right now that this messaging, this press conference right now, is oversimplifying the causes and perhaps the treatments for autism.
Erica Edwards, thank you. I'll ask you to stand by for a second while we're bringing Dr. Kavita Patel, because we also heard the president repeatedly say, hey, just don't take it, basically. And he was questioned and pressed about medical groups, experts like the College of Obstetrics and Gynecology. We know others as well who have said, hey, we believe that it is the safest option for women who need to take something, pregnant women who need to take something during a pregnancy. The president suggested just don't take it, kind of like gut it out here, which can also have its own risks, right?
Yeah, especially in the first trimester. You can have an incredible amount of risk to the fetus if you actually have an uncontrolled fever, not to mention that people who hear that and think that they just need to tough it out could actually be masking something or necessarily not dealing with something that could have an even higher implication in potentially autism. We don't know. This is why we do randomized controlled trials. And to date, there has not been a randomized controlled trial to look at acetaminophen and autism. It's actually what the one piece of silver lining
should there be?
Is there should be.
Yes.
And I think there's a lot of ethical boundaries around that, because I couldn't put someone in conscious faith on a placebo. I couldn't, given what I know about how safe and effective Tylenol is. So we would need to think about a different trial design to do. But I don't think the answer is to do what the president did, where he just says, tough it out and stop to take any Tylenol. And certainly there's probably a woman right now who has taken Tylenol today, and she is rethinking and wondering what's happening.
To be clear, too, is it your sense, based on your expertise inside the medical community, that there is a desire not to study this at all, to shut down all studies related to that?
I think the one thing that we can say about the medical community is there is no one unifying voice. When you hear all these consensus guidelines, Hallie, that doesn't happen overnight. That takes, even often frustrating to doctors like myself, decades to come to. But when they come to it, it's not just stop and move on. There is a revisiting. We constantly refresh the evidence because we see new studies. There was a twin study that was out that showed, again, no causal link between autism and Tylenol. So I think we keep looking at things because we get more and more data. And now with artificial intelligence, we have the ability to even create data sets, which I know some scientists are doing. So again, I think we need to study autism, no doubt. But I think that talking about Tylenol as this causal link is, one, it's wrong, two, it's misleading, and it distracts from so much of what we could do for autism.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app, or watch live on our YouTube channel.